Dr. Lin, welcome to the show.
Thanks for having me, man. I appreciate it.
Yeah, so ironically, we had a little bit of an issue with the time here. And so I went downstairs to my recording studio and I actually did a book review for you. Because I loved your book and I wanted to have a video book review that I release on Amazon and YouTube. So I still gave you a positive review, even though you're in London and the tube was apparently late.
Just to clarify, yeah, I was late for our appointment, right? And I was stuck in the tube with no reception. I was like, but yeah, so I was 20 minutes late. I'm sorry for that.
No, it was perfectly fine. This stuff happens to me all the time. Now, moving over to teeth. Obviously, like I said, I loved your book. Really have a lot of interesting things to talk about. Most people don't realize, I think, that tooth decay is the most common chronic disease in children. Is that true?
That is absolutely true. And, there's some startling numbers coming out of the UK. And these are pretty indicative all over the world in most, Western civilized countries that, kids today, the numbers of kids being admitted in hospital for general anesthesia to have their deciduous, that's their baby teeth, ripped out under general anesthesia are growing. So that's 45,000 kids in the UK. The numbers are also similar in the US, but it's the most common chronic disease in kids. We're still not solving this problem. We've had fluoride since the 60s and 70s. This is a huge societal issue.
And are you located in the UK? Are you in Australia? I mean, where exactly are you?
Well, I'm in London now. So we just launched because the Hay House, the book, The Dental Diet, has been launched in the US, UK, Australia, and some other countries subsequently. But so my publisher's here. I'm based in the US for work, but my practice and everything is in Australia. But I'm doing the whole kind of book process now in the US.
So where are you based in California?
New York mainly, yeah, but I do a lot of work out of California, so we're building a lot of dental education and kind of nutrition, kind of building this conversation to help dentists kind of get this message out there.
That's great. Yeah, I mean, as a little preview maybe for listeners and even for you, Dr. Lin, I want to basically talk obviously about diet and then wisdom teeth, snoring, braces, even DNA versus epigenetics and how much tooth issues, we can actually change. And I mean, just so much more, but that's kind of the overview. So, I mean, first, obviously your book is forwarded by Dr. Mark Hyman. How do you know Mark?
Well, we connected through the functional medicine community. And so, I met Mark really briefly, but we kind of kept in contact. And, the work he's done with the Cleveland Clinic, I saw that stuff and, he actually had a lot of deep dental issues himself. So he had problems with a root canal, he had it extracted, he had an implant fail on him. And so he was very interested in the whole kind of dental space because he had a lot of stuff go wrong for him. And so, we talked about that and, the stuff they're doing, with functional medicine, the Cleveland Clinic, that's really the first mainstream rollout of, how we're applying this in the broader system. This stuff is there for, kind of smaller clinics and, the more switched on practitioners. But how we're doing this on the broader scale is not happening yet. And so Mark's been so kind of instrumental in that. And I'm just so grateful that he was, kind of saw that the oral systemic step is the next big one. I believe it is in the functional medicine space.
Yeah, I think I'm at Mayo Clinic right now, as you might know, but I'm trying to, I'm talking to a lot of people about the Mayo Clinic and how we need to have a functional medical, branch set up there because it's so successful at the Cleveland Clinic. And I think teeth are the perfect example, right? Because people look at teeth, dentists look at teeth and they think, I'm just looking at teeth. But you're taking a functional approach, which is more holistic. So maybe you can explain that a little bit, how your approach has been holistic and not just looking at one single tooth issue, but the whole body.
I think you're so right there is that dentistry is the perfect example of the problems we have in allopathic medicine. And that, in my practice for many years, I used my training. I had 7 years, biomedical science background, dental, then dental training subsequently after that. When I went out into practice, our teeth are a disaster zone. And we look at tooth decay as a bacterial infection. We look at gum disease as an infection as well. And the treatments we have really don't address the problem. They patch it up. We're just patching it up and patching it up. And when I went back looking for answers, there are none, and the textbooks don't answer. And the biggest problem is that when one of the biggest health epidemics on the planet, I think, is crooked teeth. And so kids today do not grow jaws that fit 32 teeth. There is there's no even, no one's even tried to address why this is the case. We say it's genetic. It's not genetic. The genetic argument has not stood out. And, as soon as you talk to an anthropologist, as soon as you look at, those studies that kind of were popping up in the 60s and 70s, they don't play out. We don't have an answer for that. And just logically, anthropologically, crooked teeth do not exist in the human lineage. It happens in one generation once we hit the modern diet. And so a kid that needs braces at 10 to 12, is the same problem as a person that needs wisdom teeth extracted when they're 18 to 25. It is a problem with jaw growth, and it has a long list of problems that we now are hitting epidemic proportions of, like you mentioned, sleep apnea, breathing. When teeth don't grow straight, airways don't go straight, it's a huge problem. So we've got to address this. And I began to look into this functional medicine space. I bumped into the work of Weston A. Price accidentally when I was traveling, accidentally on a hostel shelf. And I looked at it, I didn't understand it. But he was a dentist in the 30s that was telling us that our jaws weren't developing when we stopped eating traditional diets. And he isolated the factors. And we just didn't understand. And I think there was some scientific plugging to put that into place. But now it's all there. Like you said, epigenetics, understanding, calcium metabolism, the fat soluble vitamins, the microbiome. That's plugged it all back in. We've got that knowledge, and we need to start using it.
Yeah, I agree with you, and I think you're right about the DNA. But I personally, here's an idea for you. Here's an additional thought on DNA. So I've never had a cavity in my life, but I don't attribute that to my amazing diet, because I have other health problems. I've grown up eating a lot of sugar, a lot of carbs, a lot of issues. So I kind of think that I happen to have extremely good genetics for my teeth in regards to, preventing dental decay, but that's just allowing me to get away with something I normally shouldn't be getting away with. I think people don't have bad genetics that are having tooth decay. I think they just have normal genetics based on our ancestry, and I just happen to have really good genetics just in terms of my teeth, but then I have other health problems when I eat a lot of carbs and have a poor diet. So it's not like I'm quote unquote getting away with it just because my teeth are good.
No, you've hit that on the nail there, and the nail on the head there. And the thing is too is that there are actually things that are going on, like with our grandparents, our parents, this epigenetic feed on, and the other thing too is that you might have eaten, let's just say theoretically, that you ate a lot of carbs growing up, and this, I've seen this as well. People that grew up with kind of this foundation in good dental health, whether it's stable epigenetics, stable diet from the parents, because we're now showing that prenatally, so what the mother eats and so how the mother breathes will affect the growth of a child in utero. And so teeth have that inbuilt epigenetic message. So they've got those odontoblasts. We've got an immune system inside our teeth. And so even though throughout your life maybe you ate refined carbs, you might have had that defense there, and you might have had enough microbiome kind of balance to counteract that out. And so it's a very complex environment. And so the defensive factors might have held that up. And we seem to have that. We're very biologically kind of robust, being. But once we go down that track, then we end up getting kind of that first, that slippery slope to chronic disease. So I completely agree with what you're saying. There's a spectrum of things going on, and we have to look at all the factors.
I'm glad you're bringing up epigenetics. I wanted to get to that for sure. I interviewed a guy named Michael Skinner. I don't know if you've heard of him, but he's a researcher, so he doesn't get out in the public a lot. He focuses on his scientific research, but he's well known among scientists. And he's the guy that discovered transgenerational epigenetic inheritance, which is basically how you can pass disease to future generations. And his science research paper that he published in 2004, for 4 straight years was the most cited research paper in the world. And he not only discovered that you can pass traits or ill traits like health problems. You can pass those to future generations. In mice, he discovered it can be 4 generations out. At least, right? He didn't even go beyond that.
It's amazing, isn't it? And the Pottinger's cat study was one of those kind of amazing examples of that. He took these cats down this epigenetic road, and at that 3rd generation, he took them back to that that ancestral. It took that 4 generations to heal. So it's amazing that scientifically, guys like Skinner, they really are plugging this in so that we can understand it at a research level. But like the messages and the knowledge was kind of there. So I think there's a real confluence of knowledge coming together. It's such an exciting field.
Well, can you maybe tell people about the Pottinger's cat experiment? Because that had to do with raw milk and raw meat, like you talk about in your book, and then kind of how that relates to humans, because raw meat for humans wouldn't necessarily be optimal. I mean, you talk about that in the book too, just so people know in terms of brain size and nutrient availability. But maybe start with Pottinger's cats. And even one thing I really appreciated that you mentioned in the book was the teeth. The teeth even changed in those cats. That was a great example. So maybe if you can tell that story.
That was a really light bulb moment for me, actually. So Pottinger was a guy he was in the 30s. He was the son of a physiologist that did a series. They were actually testing it was a medication for, I think, the adrenal glands of cats. And so what they were testing was how well they would actually excise the adrenal gland and then test the medication on a bunch of cats. So they basically had a whole bunch of cats they were doing a research project on. And so eventually what they needed to do was they had to feed all the cats. And so what Pottinger had to do is that he had to go and find all these different food scraps, and he had to go to the butcher, he had to go to the shopping mart and find all these different places so that he could feed the cats. And what he found was that when he gave a certain group of cats, or a subset of the cats, pasteurized milk or refined dairy such as condensed milk or so on, that they didn't seem to respond as well to the medication or have the same health effects as the cats that ate raw milk and raw dairy. And so what he did is he then embarked on a 10-year study, a multi-generation study on cats, where he fed a group the diet that cats are carnivorous, by the way, so their digestive system is designed to absorb raw meat and raw dairy. And so the message of Pottinger's cat isn't to eat raw milk and raw dairy as such. It's that we need to eat what we're designed to eat. And so what he did, he showed that for 10 generations, cats stayed exactly physiologically as they do, but then the test group were fed a different set of series of processed foods, so pasteurized dairy, condensed dairy, and then cooked meats as well. Humans are the only biological species designed to eat cooked foods. And so what he found was that by generation to generation, the cats began to see this decline in health. In the first generation, what happened, they got gum inflammation. Their teeth became crooked, and their skulls didn't develop exactly as they should. And that was the first sign. Now, what happened as the generations went on, the skull generation and the bone density went down. So they dropped to 10% of bone density in the second generation. So the cats weren't placing calcium. By the third generation, it was something like 2%. Fourth generation, the cats died out. Those third generation cats were so dysfunctional. They had no interest in mating. They could they were very kind of paranoid and poorly behaved in the places they were kept, and they had pest infested coats. Now what he did was he actually took those third generation cats and fed them back the raw meat and raw dairy diet, and then it went down that 4 generations to get them back to health. So 3 generations of damage, 4 generations of health. But as you say, a lot of people look at and said, wow, the cats went extinct, that's terrible, food is so powerful. But what I think is so important about that is the first change that happened are crooked teeth and gum inflammation. So that's why I think the oral systemic connection is so important. We need to see, because this is happening today. Kids don't grow, they have inflamed gums and they have crooked teeth. And then the flow-on effect is digestive problems, immune problems, type 2 diabetes, and then behavioral issues. We've got 10% of kids on ADHD medications. We put ourselves in a Pottinger's cat experiment. And so I think the real message there is what happens first, and we need to spot the signs first rather than those last, because the results are disastrous. We're talking about, really serious implications.
Yeah, and I like how in your book you talk about, you call that the canary in the coal mine situation. That's how we identify this problem, right? And I kind of think of it as a thermometer. I look at the teeth and think that's a thermometer of our overall health. And it's the same kind of concept. And most of what I'm thinking about is based on your revelation. I mean, this is really good for you to get this out. How do you get? I mean, I had a question from Facebook. My friend named Casey was asking, how do you get this message out to dentists? I mean, dentists are so focused on, what you were focused on originally, correct?
You know what? There's actually a really exciting field of dentistry that is about to pop out, and we've been talking about this a lot. If you follow my social media, and you're going to see, we have an interventive model of orthodontics now. We can prevent braces in kids. So functionally, if we correct a kid's breathing, their tongue posture, and lips, we understand their airways, their sleep. Jaws will correct naturally if we get them early enough. And so we have functional appliances to do this. We have understanding of scans and sleeps. There is a model of dentistry that is about to pop out, and so basically the conventional model of orthodontics is about to roll over. So waiting for kids to grow their adult dentition and extracting teeth, putting braces on, that's a model of the past. We now know that craniofacial growth is very, very, very important. Sleep apnea is an issue even in kids today. Kids shouldn't snore. People shouldn't grind their teeth to a pulp. These are all issues with airway. So dentistry is actually opening up to this. And so sleep and airway dentistry is a very big field that is now just starting to become mainstream. I've been training dentists for 3 years now in nutrition. And so I believe that we need to get the dental practice involved in the dietary talk, because our dietary recommendations don't consider dental health, and they have to. And are you familiar with Kate Shanahan's book, Deep Nutrition?
For sure.
Yeah, so that was one of the books that really pushed me down this path. Such an eye-opening moment, and she did such a great job in really and it's such a deep dive. I remember just reading the pages 4 or 5 times.
I even recognized your a piece in your book about epigenetics and how smoking gets inherited from the grandmother and all that. I actually recognized that from Kate's book when I was reading it. Such a great study.
Oh, it was so, and she's got just numerous. You know what? I couldn't include the amount of detail she goes into in that kind of stuff, because she just her mind's so amazing for that. And but she was inspired by Western A. Price. And when I read that book, I was like, you know what? As a medico, they don't understand the mouth, and to really unpack this problem, she talks about type 2 diabetes, heart disease, and that's really important. But I think the problem all starts in the mouth. So if we can get to growth and development and the oral systemic way of approaching this, that's the real way to unpack it. At a societal level, to get our healthcare system working properly, rather than trying to fix diseases at the end stage.
So if you're a dentist, a young dentist, and you're saying, this is true, this is, especially after people read your book, their eyes start to open. What's the first step they should be doing, to go in this functional direction?
So, the first step, I would recommend getting some kind of extra training, whether it's sleep and airway training, whether it's, there's a periodontist that's trained at the Chris Kresser School of Functional Medicine and the Institute of Functional Medicine, and he's really moving forward in showing how gum disease and bleeding gums, it all begins in the gut. So, all this gut health talk that we've been going through, the teeth and the gums are the best way to measure, our microbiome. And it's crazy, that we don't have more focus on this area. So I believe it's going to be one of the focus areas and one of the easiest to kind of intervene in. So, go and upskill yourself. Read some of the, read Deep Nutrition, read, Perlmutter's book, read your book, read all of these, Mark Hyman's book. That's a great start. All of these people have kind of, looked at these problems and tried to unpack them in a way where we're solving the core issue. And you need to see that the problem, tooth decay, gum disease, crooked teeth, wisdom teeth impactions, they're all an issue that we can intervene in epigenetics. And, read Skinner's paper. That shows you that we have powerful, interplay over our body.
Gosh, yeah. So I want to jump back a step and then, well, first of all, posture, right? I mean, you're talking a lot about diet. How does posture relate to this malocclusions or just poor arches and that sort of thing? Because I don't personally, I'm not a dentist. I don't have a lot of understanding of the anatomy, but maybe you can explain how posture is important and maybe balance between posture and diet.
Absolutely, absolutely. So the one thing that I try to frame in the dental diet is that oxygen is the number one nutrient. And so before every meal, we're breathing. We learn a breathing exercise. And so my functional therapy now is based on teaching a child and adults all the same to breathe through their nose. And so when the teeth develop, the first sign of this happening, well, the first time that's happening when we come out into the world is in breastfeeding. And so when a child breastfeeds, they have to push the nipple up to the palate, and they use their tongue to squeeze, and that squeezes out the milk. And there's this very complex, coordination of muscles that pushes the milk out of the breast, and they have this swallowing action. What happens is, so it extracts all of the milk from the breast, and the child's oropharynx is actually designed differently up until about 6 months of age. It's actually connected down to the larynx so that the child can breathe and feed at the same time. At 6 months, everything disconnects, and then we become more adult-like, where we have the separated nasopharynx, oropharynx, and such. So what that does is it actually expands out the palate, and the palate, the maxilla, the floor of the upper jaw, is the centerpiece of jaw growth. So we know now the whole craniofacial system is listening to everything, but the palate and maxilla is crucial, and that's because the tongue is designed to press up against it. So the tongue is sending physical messages all the time to expand the maxilla, and this happens right from breastfeeding. And so if we miss out on those messages from breastfeeding, we don't get that expanded maxilla. And if you take one look into kids' mouths today, you'll see palates that are V-shaped, and they're high as you can barely touch them with your finger. And that's because their palates haven't developed. And so what these kids will look like, they'll have these long, skinny faces. There's a diagram in the book that kind of shows it. This is what every kid walking into dental practice looks like today. They have slumped over shoulders. Their knuckles are hanging forward. They've got venous pulling up under their eyes. They've got their mouth open because they're mouth breathing. Their tongue is at the bottom of their mouth. And so what that does, as soon as you look in there, you can see high palate, high red inflamed palate, because the tongue's not getting up there and emitting this immune response, and they're not getting any craniofacial growth. So they've got this, we call it adenoid faces. And so what happens, they've got stuffy noses because their immune system is because they're not getting that nitric oxide through the nose, which is a whole immune reaction in itself. And then you've got inflamed adenoids and tonsils, so their airway sometimes. So you can do what's called a Mallampati index, where they basically say ah, and you can see where the tongue should basically should be able to see the back of the pharynx, so the back of the throat. Now, most of these kids, the tongue will block that, and the tonsils will be kissing in front of it. So you can imagine what their airways are like. They're basically, they're breathing through a straw. It is terrifying. Once you understand it, it's horrible because it's such, and this is the whole, Pottinger's cat problem. Once the skeletal system, the architecture doesn't grow, the airways don't grow. And so we have put ourselves in a skeletal structure that doesn't breathe properly. And so when they sleep, they grind their teeth. So teeth grinding is a neurological impulse to open the airway, because all your muscles relax when you sleep. When you snore, it's the same thing. It's those airways vibrating. That sends pressure signals to the brain that pushes the jaw forward to grind the teeth. Kids now are grinding their teeth to the gums. I've seen kids grind their teeth to the gums. That's we've given, there's no explanation for it. There's parasites can play a role, but it's all a problem with growth, airways. When your teeth aren't straight, your airways aren't straight. Like, by definition, if you have a high palate, that's driving up into your maxillary sinus. So you see a scan on these kids, and their maxillary sinus, where the palate should be like this, it's up like this. And so the airways are cramped by definition. So how can they breathe? They can't.
Wow. Yeah. Well, and let's go back to Weston A. Price, right? Because let's tell people, maybe you can explain what the proper palate looks like, what the proper jaw shape and structure would look like, starting maybe with that Weston A. Price, and maybe even going back to the archaeological records.
Yeah, exactly. So this was some of the awakening moments. I'll take you through. The first one was Price's book, and I looked at Price's book and I looked at this like, there's a bunch of baloney, like it's this old book with got black and white photos, obviously outdated because I hadn't heard of it. I wasn't taught of Weston A. Price in 7 years of tertiary education. But so what he's done is he's taken 15,000 photographs. He did dental records. He took archaeological records of the jaw specimens in each place. He also did nutrition analysis. So he measured the nutrients in each place, compared it in different populations and at home. So what Price did there, and he did, the thing is he was so ahead of his time, we didn't have any scientific way of kind of describing what he was doing. When he was taking photographs of those faces, and you can go online and if you Google Weston A. Price, you'll see these big wide faces in every single culture around the world. This is in the 30s, by the way, before the World War II hit. And it was as the industrialized diet was just mobilizing out into the world. So there were cultures living on traditional diets. They had these huge, wide faces everywhere. Every society, they had these jaws, these dental arches, wisdom teeth erupted with space behind the wisdom teeth. I don't see space behind wisdom. I don't see wisdom teeth. Wisdom teeth sit like that next to the second molar. These people had eruptive wisdom teeth. Then you look into the archaeological record, it's like that for thousands. You don't see impacted wisdom teeth, you don't see crooked teeth, you don't see tooth decay in the entire history. He describes it, if you could draw have a piece of string that represented the 2 million years that we walked the planet, the time that we see dental disease, crooked dental arches, and tooth decay is barely, you could barely draw the line with a pencil. It's that thin, and so it's absolutely alarming archaeologically what we're seeing now. Palates, we've now done the studies. So Robert Corricini, have you seen some of his work?
No.
So Robert Corricini was an anthropologist. He did hundreds of studies on dental anthropology and how malocclusion. He compared hunter-gatherer skulls. He compared indigenous strains. He compared rural versus non-rural Kentuckians. He shows in every single study, and he sums up his work by saying malocclusion is the malady of civilization. And so this is and I've seen him talk, and it's just laughable that we haven't seen this problem as a development issue. So you look at those palates and they are wide and U-shaped, 40, 50 mil plus. And so nice intermolar width where we have space behind what's called the retromolar pad. And so that's a lump of bone that sits behind the wisdom teeth. And those people, if you can, there's also a lovely picture that Kevin Boyd, a pediatric dentist from Chicago, wrote an article about. He shows that when you look at the front, you see those wide teeth. When you turn them around, the skull's around, and look at the airways. So the hunter-gatherer airways are like this, and the modern airway is like that. How simple is that? It's by definition a loss of volume in the airway, and that's why we've got 70 million people in the US with sleep disorders. So today you see this U-shape in these societies. In Price's work, all of human society, you see this U-shaped palate. Kids today have palates like that. There's a guy called John Mew and Mike Mew here in the UK that have been onto this for ages. They've been screaming about it for decades, saying we need to develop our faces. I went to see their work. They focus on getting kids growing and getting those maxillas straight. I saw wider palates than I have my entire career there, and flat, wide, and these kids had faces. They actually had faces. They had cheekbones out like this. If you walk along the street, you'll see profiles with kids with their chins back in their throat, and it's all just a functional, kind of compensation for what we're giving our bodies. So it's really alarming. It's amazing we've missed this problem. It's just sitting in front of us.
And you talk about two major historical shifts, right? The grain farming and the Industrial Revolution. Maybe you can expand on that a little bit.
Yeah, exactly. So I mean, if our archaeological record because the most common bone we find in when we dig up skulls and archaeological record is the jaw and teeth. So that's for the most part what we know about our ancestors. And there was just that recent the recent jawbone dug up or studied in where was it? It was the Middle East, or was it? And it actually dated human presence further back outside of Africa. But anyway, but what we know is that our jaws changed once we became human 2 million years ago. They've stayed the same the whole entire period. We walked the earth 2 million years until we hit the next point, which is the agricultural revolution. So once we began to have monocrops and change our, move from a hunter-gatherer, kind of way of living, that's when we begin to get tooth decay. Slight malocclusion shows up. So when these anthropologists talk about malocclusion, they're talking about little crooked teeth here. But the real kind of malocclusion we're seeing today only picks up about 200 to 300 years ago when the Industrial Revolution happens. And so there's three shifts. One when we evolved from primates, or however we became humans. The next one was the Agricultural Revolution, where we began to get tooth decay and slight malocclusion. The last one is the Industrial Revolution, which is where we hit today. I think we've actually got a new one in the last couple of decades, because I'm seeing kids whose second molars don't fit, and that is just if that's not alarming, impacted second molars. That's incredible, and that's happened in the decade that I've been out. We didn't talk about that in dental school, and you watch. That would become a thing where we have our second molars extracted then. And, what are we doing to us?
Yeah. So Weston A. Price did an interesting work on, or he did a lot of work with vitamins. And obviously when you go to you go to the doctor with thin bones, or with, or a typical dentist probably, they'll tell you supplement calcium, supplement vitamin D. And obviously the research is pretty iffy on that, because that's such a limited, narrow view. So what did Weston A. Price contribute to that? And then kind of how do you look at the supplement picture or the whole foods picture? I guess maybe combine those two.
Oh, yeah, this is I think this is why Weston A. Price's work was so misunderstood, because we have to remember that, in 38, he published his work, and it was, released to kind of mixed review. He was called the Charles Darwin of nutrition, and then kind of other societies said, this is bias, this is not, standard medical, kind of literature. There's flaws in the research. There were problems. And so 10 years later when he died, his work was lost because he wasn't around to push it anymore. You have to remember, he never found out a key part of his theory, which was he wrote of 3 nutrients that every society in the world made sure was in the diet. They ate foods rich 10 to 20 times as rich as what he saw back in Ohio, in Cleveland. And there was vitamin A, vitamin D, and he wrote activator X. And so there's this other nutrient, and he measured it in his lab. He never found out what activator X was, and it must have been the most frustrating thing for the man. Imagine doing that, going all around the world. You think you've got the key to everything, and then you can't. You die before you find out what it was. But it turns out, activator X. It took us 70 years. Price's work was lost until about 99, until it was reprinted, until the foundation really got going. But Chris Masterjohn was the guy that uncovered it in 2007. And the problem is that we really misunderstood vitamin K, which is a fat-soluble vitamin. And so vitamin K, I was taught there was K1, that's for blood coagulation. But there are 2 types, and even more types, subsets of vitamin K, which is vitamin K2. And that's what Price was talking about. And K2 works in synergy with vitamin D and vitamin A to place calcium. And so all of a sudden, we've got scientific validation for what Price is talking about. Now in Japan, they use vitamin K2 is approved by the health ministry for osteoporosis treatment. Now, I don't see any doctors prescribe vitamin K2 in the US or Australia. I see them prescribe bisphosphonates, which is an absolute disaster zone for jaws, and it is it is crazy that we've lost. And one thing that we do now, and the research has shown us, is that vitamin D and calcium supplements on their own, in 2011, they showed that you don't get an increase in bone, but you have an increase in cardiovascular plaques. Yeah, and so it's to the point that we've been throwing calcium and vitamin D at people without an understanding what vitamin K2 does. And so vitamin K2 activates the proteins osteocalcin and matrix GLA protein. Matrix GLA protein picks up the calcium from our arteries. Osteocalcin takes it into bones. I was taught about osteocalcin in dental school, but never in any detail that it's a vitamin K2 activated protein. It activates an immune response inside the teeth. Vitamin K2, vitamin D, vitamin A. The research has really kind of only jumped out in the last 20 years. So it's very new in terms of clinical applications. So this stuff doesn't hit what doctors are recommending, until a decade or two later. So there's a good explanation as to why we haven't kind of understood it, and I just think now we've got the requisite information to completely repaint it all. But so that's been the confusion, is that vitamin D is iffy in terms of creating bone density. But what the few studies that where they've tested D with K1 and K2, they show that if you add K2 to the mix, you get that bone density increase, and so for instance in the lumbar bone density. So the body needs both D. So D gets your calcium absorbing, K2 carries it into bones and teeth and out of the soft tissues. We haven't completed that picture. That's what Price is talking about. This is what we need to understand. And I think it's just so fundamental. I think those three things, because people didn't have supplements and whatnot, 20, 50 years ago, but they made sure they ate these nutrients. And that's what Price was talking about. I think we need to take that understanding from his work.
Yeah, it's ironic. I just finally was introduced to the Weston A. Price Foundation myself this year. I went to their conference because it was here in the Twin Cities in Minnesota, where I'm living. And I was really, really impressed. I was just on their podcast, I don't know, about a week or two ago. And I mean, I'm just so impressed with the whole group. I met Chris Masterjohn, hung out with him after the after party at the conference, and talked to him a lot. Actually, he's a PhD scientist, so we kind of got to go into depth on a lot of different pathways, methylation, epigenetics. But I mean, the problem with modern doctors, I think, is they're gonna take what you're saying and kind of translate that as, let's just supplement vitamin K2, throw that one into the mix, and just ignore kind of the bigger picture, the good fats, the vitamins, the probiotics. I mean, not the vitamins, but the whole foods. So what would you say about that?
Yeah, look, I think there is a role of supplementation, but so in the dental diet, I didn't mention this because I didn't want it to be about this, and I think as the clinicians, I think we need to understand supplements and their role in health, but at a broader population, where for parents, for our own health, you and I think we need to understand that food is our long-term path to health, and that supplementation, the perspective that we've gained on what we know, folic acid is a great example. The mess up that we've made with folic acid, and that's not even being untied yet. We really need to understand that what we can make in a supplement in a bottle is so limited. And I think a good example, for instance, is vitamin D in the body. Well, what are we designed to get vitamin D from? Well, the sun. And we're just starting to learn that all the other things that the body does with sunlight, besides kind of lift the active vitamin D in the body. So, and there's even links between skin cancers and vitamin D deficiency now. So there's so many things we don't understand. That's what epigenetics basically shows us. If there's any kind of real message we can take out of epigenetics, is that it's so complex, and we have to be kind of humble, I think, in how powerful nature is and how smart it is, and really get back to that knowledge, because the Weston A. Price Foundation has been talking about this for nearly 2 decades now. We need to take this whole food approach, this reductionist approach to nutrition, reductionist approach to the food supply. It is all harmful because we don't have that whole picture, and I don't think we ever will. If you think about the human microbiome and the epigenetics to get, there's so much going on. We can't have RCTs that isolate every factor and prove that this, it doesn't happen. I think we need to take a broader view.
I agree. I'm doing research experiments at the Mayo Clinic right now on infrared light, and I'm shining it on stem cells and kind of reprogram stem cells. But there's just no way to completely imitate the sunshine. I mean, there's just never going to be as much of a benefit as there would be from going outside. And I think Whole Foods is the same way. You can't just make some kind of a powder or formula. You can kind of try and, like you said, I mean, I think you have a really good kind of context for all this. And fiber, right? Like, you talk a lot about fiber in your book. Maybe you can expand on that a little bit, just in terms of gut biome, starting with the mouth biome, and how that impacts your health.
Sure, yeah. I mean, the real thing I think we've learned about, and I think tooth decay is a great example, is that we've had this infection model of, that harmful bacteria, kind of release acids, cause decay. Now, since the Human Microbiome Project, we've understood that trillions of bacteria, and this is less than 10 years ago, trillions of bacteria live in the mouth, live in the gut, the whole digestive system. And you've got to remember that it wasn't in the 80s, there was 2 Australian scientists that were laughed at for saying that one bacteria could live in our gut. This is how, like they said, well, hang on, we think that stomach ulcers are caused by a bacteria, and they were laughed at, they were ridiculed until they had to drink, H. pylori themselves, a broth, a test tube of it, and give themselves stomach acid ulcers and cure themselves with antibiotics. Then 20 years later, they got a Nobel Prize. So that's what you have to do to get a Nobel Prize, apparently. Yeah. But the perspective is changed, and so tooth decay as an infection kind of model that's very, very limited thinking. And so we now know that the oral microbiome has 600 or 700 species. We've only identified half.
My take on it is that these bacteria, they're conjugating all the time, and they can pass DNA back and forth. So like, what's a species? At some point you have to say there isn't really a species anymore when there's 2 kind of bacteria that are just conjugating and passing back DNA. So it's even more complex than 700 plus species.
That's such a great point, because I say species, but really when we say, we're thinking of kind of like, a species of bird or animal, as we do, but like, as you say, it is so complex. And then you go to, different types of microbes, Yeah, so one thing that we've really kind of misunderstood is that plaque and calculus, well, calculus not as such, but has a biological purpose. And so bacteria to live in your mouth, they need to build houses, and that's what plaque is. And so we've been scrubbing and disinfecting plaque with mouthwash, but really they're the bugs that actually protect us against disease. And so what the Human Microbiome Project taught us is that there are microbes that live and they protect us against tooth decay, they protect us against gum disease. What happens is they actually perform a biological function. So they actually exchange calcium. So they mediate the pH of the mouth via the metabolome. So the oral microbiome studies now measure in the overall metabolic activity of the population. And so that's basically, we say, sugar plus bacteria equals acid. There's so much more going on for that to happen. And so what we're basically seeing is that that for tooth decay to occur, there is a run-on of things going on, and the overall message is that diversity is more conducive to health. That's what the microbiome research. That's what the overall kind of conclusions we can take. Because when we talk about one species this and 2 species that, it is such a small bit of the picture. And when you look at the studies, of plaque from hunter-gatherer populations, thousands of years ago, the gut biomes of people still living today in hunter-gatherer societies, they have much more diverse plaque, they have much more diverse gut biomes, and they don't have the diseases we have. So diversity, protective, so probiotic species in the mouth and the gut are key to harnessing health. That's why we didn't get tooth decay back then. That's Price went around and he wrote down, he said, these people, they have this green mossy buildup on their teeth, but they don't have decay. And they didn't brush their teeth. They didn't brush their teeth. Like, toothbrushes were only invented, barely, in the 50s or so, and no one's really using them properly anyway. But so we've had the system there. It doesn't exist in any biological system, because once you have it all balanced, dental diseases don't occur, gut problems don't occur, and it's all a flow. And we're swallowing thousands of bacteria every second. It's communicating to the gut. It is all happening in the mouth first, and we've had so much research pop up, about the gut microbiome, thousands and thousands and thousands of papers. But we've had a lot less on the oral microbiome. I don't understand why it hasn't been more of a focus, and the dental industry has to jump in on that. We have to own that, and we have to, talk about how what we see in terms of disease can be, how we can relay this to microbiome medicine in the gut, because this is all connecting. Your gut connects to your metabolism, to digestion, obviously, to the immune system, to the brain now. So we've got it all here in the mouth. Let's start bringing this all together.
I know, and just to kind of emphasize, I was really interested when I was reading your book I learned, I didn't realize they could take DNA out of these plaques from these ancient, civilizations or whatever, and actually identify what bacterial species and the diversity. That was really interesting. And of course, like you said in the book, and just now, they confirm that these days with these tribes that are still out there. So it's good science. And I mean, that's really powerful. And of course, I mentioned this on Twitter to you, but my group from Boston University Medical School was the group that discovered that plaques in your teeth literally leads to more plaques in your arteries. And when we came out with that, everybody said, no way, that doesn't make any sense. But the data was the data. And then we also discovered that these pathogenic bacteria, these suboptimal bacteria, whatever you want to call them. I mean, you can't necessarily say they're pathogenic, I guess, because, but these bad bacteria are secreting inflammatory factors into the bloodstream, and that's systemic. And that was kind of our explanation through publications and kind of what our research went. But I mean, you're going way beyond that.
Yeah, that was so. And the really interesting thing I think about the plaques that you're talking about is because in kind of when you go and get your dental clean, for instance, we know we've got plaque that builds up, the pellicle that builds up in the tooth, from 20 minutes to hours. But so what we get cleaned off at the dentist is that hard bit of calculus behind the front teeth, right? The one that really hurts. And so dental calculus is different to plaque. But so what's happening there is that, so I would see people with this caked on calculus. So people get different levels. Some people wouldn't brush their teeth, wouldn't get any calculus. And so now we're kind of connecting this whole dot, between even the coronary calcium score. It's an inability to manage calcium in the body. So they're now showing that the coronary calcium score is one of the best measures for cardiovascular risk. Now, if you have plaque that builds up in the mouth, those same proteins, matrix GLA protein, which is a vitamin K2 activated protein, if that's not present in your saliva, we know it's present in the saliva and we need to activate it. If you don't have K2, you're not going to be able to place calcium into the teeth. So you're going to have this calcified buildup, tartar, dental tartar. And the same thing is happening and Kate Shanahan talks about this, and the very forward-thinking cardiologists that calcification might be the issue, and they've found plaques that have these bone spindles in them. So what you guys found is exactly on this process, and it's just showing that we need to understand this connection, or it's and the other way around is just so more complex, and we just don't get there otherwise.
Yeah, it's also interesting at the Mayo Clinic. Just today, I literally proposed to the orthopedic surgery department that we look at people's teeth and how many cavities they had at the very least, and because we're studying fibrosis, arthrofibrosis, which is scar tissue in the joints.
Yeah.
And I proposed that we compare the dental records, because we have some extra summer students coming in. Yeah. And we have them sifting through the dental records and comparing that to the medical records and how many people are getting scar tissue, because there's probably some systemic issue there. But then they said, well, we don't have access to the dental records. And it goes back to this whole thing we started with, which is the medical system isn't set up to be holistic. It's not set up to be comprehensive. It's such a hassle to even look at the dental records for the medical doctors that we're not doing it. And I guarantee you there'd be something there. I mean,
it's so interesting, because like at the start of the story, at the book, we talk about the patient I had who was going in for quadruple bypass, and he had chronic gum disease, and he had a letter from his cardiologist, and he said that he needed a dental clearance. And the basic, you've just described the kind of situation there, is that because in hospitals and in medical settings, there is no, if you have a dental abscess, during when a patient's recovering from a heart condition in hospital, there's no way to treat. There's an absolute disconnect there. And so he died after his surgery. So he never made it back. I had to extract his last teeth, but he died. And the problem was the process was going the whole time. I'd only spoken to his cardiologist once he had this very end-stage disease, and that's unfortunately where we're at. Interesting, actually, you should look into a little bit, is I've connected with a dentist online who's very into osseointegration with zirconia implants, so the non-metal implants, and so that they use certain substances, so K2 for instance, to help osseointegration in the jaw. So that might be kind of in terms of connected in some way in that research field. Yeah, it's interesting stuff.
Yeah, and maybe we should end on one final thought, because I want your take on dental floss, because obviously as I look at the research, it's actually pretty shameful. You know, this idea that, oh, you got to floss and floss every day and all this. And I mean, what's the research on that? Because I haven't given it the deep dive, but just superficially, every once in a while I see a study, and you know, it's become a dogma that you've got to floss. Is there any scientific research that's pro or con?
Well, you know, the FDA in 2014, they threw out their backing of the health benefits of flossing because the research doesn't support it. And you know, like the way I kind of look at that is that, well, once you look at it from the perspective of what we know about the microbiome, you know, the inner immune system of the teeth, you know, the osteoimmune system, fat soluble vitamins. Of course, running a string through the middle of your teeth isn't going to have a causative, you know, relationship, you know, or protective relationship to tooth decay. And so that's what the research shows, and I think that explains, yeah, it's far more complex than that. And the way I kind of think of it is, you know, like brushing and flossing are the same. You know, when you've got a car with an engine problem, you don't take it to the car wash. You have to look under the hood and understand what's happening, you know, with the engine. You take it to the mechanic. And so brushing and flossing, all of this superficial stuff we've been doing is a very, you know, it's all relevant, but let's understand what's happening in the body, because we have the pathways, we have the scientific understanding now. We need to go beyond what we've been doing because it's not working. The disease levels, you know, we need to go, you know, understand the jaw as a growth vehicle that we have to guide through food, and that nutrition is the core base. You know, we can add all these other things on top, but nutrition is the core base of what we, you know, really need for, you know, oral and whole body health.
Yeah, it makes me even think this, you know, using SLS and the toothpaste and all this, especially if people are reactive to it, it's probably completely counter to what they're trying to accomplish, because they're probably causing inflammation in the teeth, you know. And I mean, what about fluoride? Is that a similar story? I mean, that's a complex story when you dig through the research, but what I've seen is a lot of people are saying fluoride works great, but then you look at the data and it shows it's not doing anything.
Yeah, I mean, but let's look at you know, kids, you know, tooth decay is still the most, you know, common chronic disease in kids today, so it doesn't work. Well, look, but so fluoride works in a very, very kind of small field. So what it does is it's integrated into the hydroxyapatite structure of the enamel. And so when you think of that, right, okay, and it does make it more acid resistant. So I've seen kids grow up in the fluoride kind of era and have kind of this harder enamel. But at a population rate, it doesn't work. And so if you think of it in a physiological sense, the immune system, the osteoimmune system inside the teeth, and so the vitamin D levels of the kid, you know, their fat-soluble nutrients, all the things that Price talks about, then the microbiome outside, so all the bacteria that are supposed to be, you know, involved in ecological kind of processes, you know, having that enamel, fluoride inserted into that enamel, is a very, very small window of what we should do. And I think there's a clinical application, but we need to understand it as a treatment. So in rampant caries, I think there's probably a topical clinical application of fluoride where we can get that fast remineralization. However, why aren't we talking about vitamin D levels? Why aren't we talking about K2? Why aren't we fixing their diet in an effective way? And so fluoride is just a very, very small, you know, aspect to that, and we need to see it like that. It needs to be you know, I don't think fluoride toothpaste is particularly useful because it's at water concentration levels. So if you're putting a topical, you know, water concentration to get the benefits of tooth decay, the research shows you have to take that systemically for it to be incorporated into your enamel. So toothpaste is useless. You have to have it at a higher concentration. So there are clinical applications. I think the research is iffy, but it's, you know, if you kind of, you know, I think in certain situations we can use it, but it needs to be seen as a treatment. It's not prevention.
Yeah, I agree, and I think if people are eating food that's holistic and it's from good soil, they're getting trace amounts of fluoride anyway, systemically, the way they should be, and that's probably optimal based on your book. I recommend your book to everybody. Thanks for coming on, Dr. Lin. If there's anything you want to close with in terms of where people should find you, should they follow you on Twitter? Are you a huge Instagram person? Maybe this is the time to let us know.
I appreciate it, man. Yeah, so I mean, they can find me at drstevenlin.com, so drstevenlin.com. on Facebook and Instagram at Dr. Stephen Lin. The book, The Dental Diet, is on Amazon. So it's kind of this whole trip through the mouth, the body, how to eat. It's a 40-day meal plan to kind of reprogram, because I was trying to tell my patients this, and I had all these food plans, and we had to put it together. So it's a 40-day plan to really kind of get yourself out of these traps. And so, but thank you so much for all the work you do. Because your research and your work, we really need this going forward, and people like yourself that are switched on to the fact that we need to change things. So thank you very much for that.
Thanks, and thanks for coming on. Jerome wants to say hi quick before he jumps into the other room.
Hey there.
How's his jaw looking?
What's up with that tongue there? What are we doing there?
He's got a bad habit of licking his lips. Bounce into the other room. Good job, bud.